Hi, this is Mark Grossarth from Heritage Family Credit Union. Heritage Family Credit Union is a proud sponsor of the 2020 Bennington Chamber of Commerce Lunch and Learn series. I hope you find these seminars insightful and educational.
Good afternoon, everybody. You're joining us again for Southwestern Vermont Chamber of Commerce special telecast. We've been doing these in the midst of the COVID crisis, COVID-19, and hopefully we're providing you valuable information as new news comes out or as we're dealing with the stress and the anxiety of the current crisis. We're here live at CAT TV Studios in downtown Bennington. As we've said before, we're live on Facebook as well. I'll be monitoring, and so will the staff at CAT TV, those comments. So if you have questions, that's kind of what makes this show relevant and interesting, is hearing from you, the community, and then our ability to ask our special guests today. We're switching it up a little bit from Southwestern Vermont Medical Center, and last time we had Tom D. and Dr. Dobson on. This time we thought we'd take a different angle. We'd like to invite United Counseling Services here and to talk about a little bit of what we're all experiencing now, a week or two into the stay-at-home order, and really around mental illness, or at the very least anxiety and concern around health when it comes to COVID-19, and how do we deal with those triggers. And so today I want to invite and welcome Executive Director Lorna Mattern, as well as Medical Director Dr. Alia Reeve, and I want to thank you both for being here today, taking some time out of what would probably be a very busy couple weeks, and will continue to be a very busy weeks for you ahead. So thank you.
You're welcome. Thanks for having us.
As you'll notice, we are again sitting apart. So I'm in one section of the studio, and Lorna and Dr. Reeve are in another. Out of respect for the 6 feet apart, we want to make sure that we're practicing what we preach, and so I will be sitting off camera from them, but I think we can still have a very intelligent and a very informative conversation, especially from the whole spectrum of mental health, and really talking to the community about what are some key things that we should be doing to make sure that we're continuing to exercise mental health, as well as some of the services that United Counseling Services offers. So maybe we start there. Sure. Lorna, why don't you give us a little bit of background about the United Counseling Services, what you have offered up to date, and maybe some special offerings with COVID-19.
Sure. Then,
right, and we don't have to go all the way back to the first days of UCS.
Of 60 years ago. No,
right.
We'll keep it present. So United Counseling Service is the designated agency for the state, for Bennington County, and what that means is that we are essentially designated by the state of Vermont to provide mental health, developmental disability services, crisis services, substance abuse services, youth and family services, and services to the chronically mentally ill, and we're designated to do so by the state of Vermont. And so we provide outpatient services up at our Ledge Hill Drive location, as well as in Manchester. Substance abuse services, which is also probably an area that we should be talking about a little bit today as well, and 24/7 support to folks in group homes who are not able to live on their own successfully or safely, as well as 24/7 crisis services. We have continued to provide those services at the same level, if not at a higher level, since the coronavirus came in. Very quickly on, we switched from in-person, face-to-face therapy sessions to telehealth and telephonics. So we have therapists now who are actually at home with their own, developed their own home office, providing services to clients and folks in the community through telehealth and on the phone. We have emergency services folks who are providing 24/7 care, and I'll have Alia talk a little bit more about that. But our offices are open, and we are available to folks whenever they need it, both for clients and for people who are not clients, people in the community. So really hope that people get in touch if they need to. Do you want to talk about emergency services?
So in terms of the logistics of emergency services, we have the adult emergency services who actually serve lifespan issues, and they are mobile now virtually by telephone and video means. Some of it is Skype, some of it is Zoom, some of it is FaceTime, depending on the means that people have at home, and using the same systems to talk to doing emergency evaluations when people show up in the emergency room, in order to not clog the emergency room and to decrease exposure to our staff. And many people's initial response to that is saying, why do you not want your staff to be exposed? Aren't they supposed to help people? And it's like, well, yeah, you do want them to help people. What you don't want to do is you don't want them to be the vector that contaminates other people. So by keeping them out of the emergency room where there's going to be a concentration, and even with protective equipment, you're going to have some risk of exposure. You don't want to drag that into somebody else in the community. And so one of the things we're very cognizant about is not being vectors to spread the disease.
Mm-hmm.
So that's why we're using televideo and telephonics. In addition, we have a very close collaboration between our youth family services system and the around-the-clock emergency services. We have family emergency services who work closely with families and with kids, often in the past going into houses. So they're having the biggest change of not being able to do that. You know, just as we were making this switch, one of our FES employees was on the top bunk with a kid, getting them to come out from under the covers because nobody could handle the situation in their house. So what they're doing is using FaceTime, phone, talking with them, developing sensory to-go bags, so that some of the tools that you would normally have in our psychiatric urgent care for kids facility, parents and families could be employing at home. So we're developing that for people who don't have it. We're also looking at, some families don't have, for financial and social reasons, they don't have access to a telephone, a smartphone, a tablet, a computer. We're, through UCS, buying and investing in tablets that can do this same communication, so that when we find somebody who doesn't have that system, we can give them a system that then we can communicate with them from outside and develop relationships.
Mm-hmm.
So it's really important that we're doing this around the clock. Going forward, we're looking at trying to relieve the pressure on the emergency room for emergency services for psychiatric conditions. So that means that we're not trying to skip any medical needs, and anybody with or without a chronic or an acute psychiatric illness who needs medical attention. Very much everybody should be directed to the emergency room. But as you know, in the last 10 years, the emergency room is the common place for primary care, for urgent care, for any health questions, because you can't reach a provider's office. And so it's been overutilized. We're trying to keep the people who have primarily a psychiatric illness or exacerbation or acute anxiety out of the emergency room, who do not have symptoms of COVID-19. So they don't have a fever, they don't have a new persistent cough, they don't have shortness of breath. They are presenting medically stable. They don't have an exacerbation of an underlying diabetes or heart disease. That's not who we're talking about. We're talking about people for whom all those medical things are stable, but their psychiatric state is not. That we would then be doing those assessments off of the SVMC campus on our campus. And we're just working it out, and the details will be up next week.
Right.
And you're located right there, almost on the campus of SVMC, so there is a great partnership there, and
Yeah.
even ease of access.
It's very easy to access us from the hospital. We are literally across the parking lot. We're actually built on the property of the hospital. So we do have a great relationship with the hospital as it is anyway. And it is very important that we continue to keep people out of the emergency department. As Alia said, we have more of a habit, I think, of saying, well, go to the emergency department for anything. And so we're really trying to be able to break that habit. And if people are not sure what to do, just call our main number, which is 802-442-5491. And we'll help direct you as to whether or not just come to our office and we can work with you rather than go to the emergency department, because people in a mental health crisis don't want to also put themselves at risk of contracting the disease or spreading the disease as well.
Did you want to talk about the warm line idea too?
Sure, and we
That's related to
actually
that?
just created a warm line. So rather than call our main line and be sent directly to an emergency crisis worker who may very well be in the middle of a crisis around somebody who is experiencing suicidal thoughts, the warm line allows you to speak to a clinician right away to help talk through if you're feeling anxious. If you're not quite sure if maybe your anxiety is kind of moving into the place of panic, and how to be able to talk you through that. Again, without going to the emergency room, without needing an emergency clinician, but you have an urgent need to talk to somebody right now, our warm line allows for you to be able to talk to anybody right in the moment that you call.
That's great. So, Lorna, maybe a question for you, but I want to follow it up with how can we help as a community. But what was your normal intake or your normal patient load, I guess, at UCS, maybe from a staff perspective, and then and what you would have normally been doing, and has that increased because of COVID-19, or have we had to decrease your staffing to kind of mitigate some of the spread?
Sure.
What does that look like? And I think the follow-up question is, people watching, we heard about the tablets and things. Is there a way that if we're making donations or helping UCS, could we do that?
Sure. So I would say the very last question is the easiest. Yes, you could. Absolutely.
We'll always
We'll
take
accept
Always.
donations gratefully.
Yeah, I think that if people do have electronics in their home that they're not being used, that you could bring that to UCS. I would leave it outside. We actually have an intercom at our office, because rather than people just walking into the main office, we're screening them at the front door to make sure that they haven't been exposed or had a fever prior to allowing them to come in. But the other question, as far as what our volume was, we actually just in October began what we call same-day access. So rather than even having appointments made to come in and see somebody, people just need to walk right in our door, and you'll be seen as soon as you come in for an intake to be able to see a clinician. And we were probably at that time, gosh, I think at that time we were seeing up to 5-9 people a day who would just walk in to be able to see a clinician. And we were able to then make an appointment with a clinician within an average of 9 days from that initial appointment. So there was no wait time for an appointment, and the turnaround time to see a clinician was 9 days. I did talk with the director of outpatient, who actually you saw here a couple weeks ago, Lori Vatican, and she had a staff meeting with her staff, who are all outpatient clinicians doing telephonics and telehealth, and they said, we're busier than we've ever been. So we have, generally speaking, a pretty high no-show rate, so we have about 35 or 40% of our people don't come in for their appointments. This has cured our no-show rate, and people are really accessing our services, and they're following up with their appointments. So pretty high level of appointments coming in, and more people that are still calling and having intake. So our folks are very busy and very full, which we're happy that they are.
Yeah, and I think that the staffing hasn't decreased. The distance between staff and the distance between staff and clients has increased.
Yeah.
But the connection has, if anything, increased.
Yeah.
And there are things that we are not alone. I am on a weekly call with the other medical directors of the other designated agencies, and one of the things that's on their agenda is to monitor the efficacy of this connectivity and look at regulations in the future at the end of this outbreak and this pandemic. What needs to be implemented and continued in terms of telephonic, televideo connectivity that is much more user-friendly, much more meeting people where they are. It is disappointing when people don't answer their phones, but as you say, mostly over 90% are answering and saying, glad you called.
Right.
And this is what I'm worried about.
Yeah.
In the time that we've had the universal access, we've had mostly good success. We've had a couple of people where there have been major communication glitches. And that pointed out to us how we had to tighten up monitoring who was sitting in the waiting room, who talked to whom. When you start something new, the human factor of communication is the big unknown.
Right, which
and
is
the
what we're in the middle of
opportunity
right now, actually.
to make mistakes.
Right.
And yeah, that's why I'm bringing it up, that
Right.
this time it's more visible because everybody's in it, and we're doing conversations publicly.
Right.
Whereas if we'd done that in October, it would have been more sensible too.
Right.
We just don't always think about it.
Right.
If you're just tuning in, I'm joined by UCS's Lorna Mattern and Dr. Reeve. And also, if you're watching on Facebook Live, please provide some comments, some questions. They're here so that we can answer some of those questions. But I have a couple others I'll follow up with. And Dr. Reeve, it was right on the heels of what you were talking. One of the things we're seeing from a business community, even just in the early stages of this, is some quite innovative things that, whether it's moving your whole point of sale system to online, to doing curbside pickup, to doing, for some restaurants, it's innovative to be delivering food too. So they've really had to put on their thinking cap of how to survive in a COVID world. Other things that
New-term
you're
COVID
seeing,
world.
any other things that you're seeing in terms of innovation or lessons learned? Necessity breeds innovation. I'm sure we're just at the beginning part of this, but I think all our hope, and especially my hope, would be pressure produces some of the best results. So other things that you're seeing, or even you, Lorna, from the UCS perspective that you're innovating right now?
Sure.
Well, we're seeing, we were in the process of reorganizing services and how UCS is conceptually structured. And we're seeing that this is just moving it faster and reducing resistance. So a very concrete example is, in order to anticipate the need for inpatient level of support, psychiatric level of support for people, it is likely that inpatient beds in our limited services system will be filled. We're adapting our capacity in a setting where we normally have a few people in a very minimally staffed setting to have a higher ratio, more structured activity. Where are those staff coming from? We don't have new dollars and we don't have new people, but we have people whose job necessarily, by virtue of the social distancing, are no longer able to work in the community with their individuals going everywhere. So they are, quote, out of work, but they are available workforce, motivated, experienced in working with people. They are today, tomorrow, Monday and Tuesday, have a scheduled training to bring them up to speed to be able to staff a program like this.
Yep.
So that we could run an inpatient unit equivalent, not locked, but very intensive. So we're moving a number of our services to 7 days a week as opposed to 5 days a week. We are seeing groups, and I got to overhear, because I helped one of our clinicians set up telehealth for his group. I got to overhear the very productive support that the clients gave each other through video, phone connection, therapists sitting in the office, by video with one in the other room in our building. So three-way conversation between the parties, supporting each other in pragmatic problem solving.
Right.
So these are really good.
Yeah, and there's a couple even like smaller things that I think make a big impact. I was talking with Betsy Rathbun-Gunn, who's our early childhood director, and as many people know, with the schools closed, Head Start is also closed. What they have been able to do on a daily basis to connect with children and families is they read a story a day on Facebook. So they're reading stories to families, and families are responding and talking about how wonderful it is to see you. We have parent group that was starting, and at the time had about 10 parents signed up. Now there's 100 parents that have signed up, and they're all doing it through video. And our Youth and Family Services program has started a YouTube channel where they can do mindfulness and yoga and groups and various other things with the children and the families that they've been working with that they haven't been able to connect with because of our COVID world. And so we really are doing some very kind of small and meaningful things, but also some very, very big system changes within our world to be able to respond to the changes.
Great. Lorna, you mentioned mindfulness, so I think it's a good transition to really speaking to our audience. You know, we're probably all on some spectrum of anxiety and extra stress. And Dr. Reeve, weigh in here. Let's talk a little bit about mindfulness, resiliency, and even mental health tips.
Sure.
Where to start for the average person? Let's start there, and then let's progressively get more on with
Sure.
people facing mental health issues.
Sure. I'm anxious about this, and you know, I want to make sure that my staff is doing well, and that our community is doing well, and being able to make all of these changes on the fly very quickly, knowing that I have decisions that I made at 10 o'clock on Monday are very different than the decisions that I have to make at 1 o'clock on Monday. That's how fast it's moving. So it could be pretty anxiety provoking. And I would imagine also for others who are very much in the same situation, what's very important to me and for everyone, I think, in this situation is to make sure that you stick to your routines. Even if you're not going to work anymore, it's important to get up, to take a shower, to change your clothes, get out of your pajamas, get out of your sweatpants, because routine really does make a difference in helping us to decrease our stress. I'd caution people against those news junkies out there that are really looking at the news to, first of all, make sure that you're using really good, solid news sources like CNN, and you're going to the CDC website. SBMC has a wonderful website,
Very strong.
Vermont Health Department. So you're getting really good information, but then the other thing is that you turn off the news and you stop listening to the news. You turn on the radio and start listening to music. Full disclosure, I did a little 80s dance party in my kitchen. I've probably given too much information, but it's really important to laugh and to try to de-stress in those ways, including mindfulness and paying attention to your breathing and making sure that you're taking some good cleansing breaths when you're starting to feel like you can feel that anxiety starting to rise. And when you feel that, to take 4 nice deep breaths in and letting 4
Good exhalations.
4 exhalation. With social isolation, I know there's a lot of people that can't get to the gym and can't work out, but exercise is incredibly important. YouTube and online services are wonderful places to find yoga instruction, to find even somebody to be able to facilitate a meditation for you and a mindfulness moment or session for you. And using that, the video to connect with friends and family via video and FaceTime, and making sure that social distancing, you know, I heard this term physical distancing, that we still need to be socially connected, but we need to be physically distant. And so those are things that just every person could be doing to help decrease your anxiety, increase your connection with one another.
So one of the things I would like to piggyback on is that you must not get rid of all anxiety. If you get rid of all anxiety, that's not compatible with living. That means you stop looking to see whether or not there's traffic before you cross the street. That means that you don't notice that the stove is on when you put your hand on it. So you have to have some level of anxiety, just not enough to interfere in your function. Mm-hmm. And there are people, and certainly we who prescribe medications and do psychotherapy and cognitive behavioral therapy and dialectical behavioral therapy, meet with a lot of people with anxiety disorders where it's persistent, intrusive, sometimes and often related to past histories of trauma, sometimes to overwhelming biological flooding, lots of different causes and etiologies. Even that pathological interfering anxiety can be managed. So it's not that it's gone, it's managed in this moment. And mindfulness, more than anything else, is recognizing that, for example, this program is going on for about an hour. We are not here and talking if we are thinking about what we're doing an hour from now. That is the mindfulness of an hour from now, not the mindfulness of the present. And what we're talking about in mindfulness is how to be present. So if you're not very comfortable sitting and being a good yogi in a lotus position, which many of us in the Western world are not great at, if you have a religious background or a spiritual framework that you operate in, almost every single one around the world and in their traditions have mindfulness practices built in them. Some of them are by repeating prayers, some of them are having certain rituals, but you don't have to be of a religious background or persuasion. You could also just be good at being very basic, cleaning the bathroom or doing the dishes. The trick of mindfulness is to only be doing what you're doing at that moment. That's the real mental exercise. If you're running, you're just running. If you're washing the dishes, you're just cleaning the dishes. You're not solving the argument with your mother and are planning what your brother should do next year about his relationship with his girlfriend that he has some concerns about. You should be focused on washing the dishes. That's mindfulness. What that does to your body is it integrates your attention, your emotion, your physical movement in all the same moment. And that is the whole point of getting yourself to slow down and not speed ahead and have your thoughts one place and your body another and your reactions another. That's what's causing integration. And the more experience you have of integration, the less panic you have because there is less out of your control. And it's not that you're controlling it, it's that you're influencing it and aware in the moment.
Right. No, and that opens up a lot of different questions I was writing down, and maybe to.
That's me.
No, that's great.
There's always questions. There's always more to learn and think about.
Perhaps the silver lining, and for us eternal optimists, will provide one for you. What an opportunity at home to explore new things in the privacy of your own home, where you might not have done it at the public gym, but now you're downloading a YouTube thing and you're trying out, 10 minutes of mindfulness or something like that. So for those, this has given everybody carte blanche to throw out somewhat of your normal daily routine and perhaps even some of those bad habits and really kind of focus in on, wow, I've got 24 hours really to somewhat of myself to perfect or to work on. Some things I've heard about and maybe I haven't really explored, but now I've got time.
Like to
That's right.
Challenge your words.
Sure.
That you don't want to perfect it.
Yep.
That's going back to judging, which is kind of the opposite of just being present, which is accepting the reality of what we're dealing with. Because that's really the challenge from Governor Scott, is to say, if we want to not make this worse, we want to keep everybody far from each other physically, we want to not spread this virus. And we want to make it so that the entire population, as much as possible, gets through it. So it's not about being perfect, it's about being good enough.
Well, and I think, you had mentioned about trying something new.
Yeah.
And I think the important piece is when you're home alone, trying something new, and, you're doing yoga for the first time, and you're trying to do a downward dog, and it doesn't work so well, that you also can laugh at yourself. That's part of the joy of being able to be by yourself in your home, trying something new.
Sure.
That when you make a mistake or when you know you kind of look goofy, then you can kind of laugh it off and go on to the next thing.
So, to that end, a lot of us aren't home alone. We have pets and families, and even, one might argue, even if you are home alone, you have the balance of work and life and play. What are some good tips, or how do I balance my work, homeschooling, pets, the household chores? What does that look like to both of you?
It looks different for everybody. I think the trick, as Lorna said, is to have something of a routine. And that routine doesn't have to be exactly the same, and you don't have to, because school always started at 8:03, doesn't mean you have to be sitting down to your first lesson at 8:03. What it does mean is you have to have a dedicated time to sit down and a dedicated time to move away from that. And I would strongly recommend that you intersperse, especially when you're in a more confined geographical area, that you intersperse sedentary activity with physical activity, and that you will do better at both, alternating back and forth. You will do better if you don't just sit, but you also stand, that you walk around, that you do physical exercise. If you don't do physical exercise, you will have trouble sleeping. If you don't sleep, you will have trouble with your mood and your attention and your concentration, and you will worry more, you will fret more, you will have greater lassitude and fatigue, and it will make it harder and everything will seem longer. Finding things that are meaningful, going outside and using the public lands, like the Mile Around Woods, like the trails off of Branch Street. Don't go in a time when there might be more people. You want to go at times where there are few. You want to go far apart. You don't want to go in clusters. But if you own a couple of acres, go outside and do chores. Go and look at the stars. Go look at the clouds too. Some days it's pretty gray if you want a study in gray. But it's the variety. It's the curiosity about what makes things work. Don't do your best to ask yourself to be creative with the situation rather than looking at what you cannot do. There is a lot we can do. You can be as simple as starting to do interactive games, and if they get too easy, make them a little harder. So you got bored with filling in coloring in a book. Well, what about one person doing squiggles and the other person making it into a story or into a character or filling it in, so that you start being a little bit interactive. You got more ideas?
No, you've pretty much covered everything.
Well, that's good. I've got more questions coming in, so
Okay.
we'll
Always
go through.
questions.
Dr. Reeve, you talked a little bit about sleeplessness. For some people, that's one of the byproducts of anxiety or keep thinking about things at night. What are some best practices and tips to help with sleeplessness? I think everybody may go directly to medicine, but I think there's some holistic practices too that might help.
Absolutely.
There are, and there's a whole series of things that we put under a heading called sleep hygiene, and it doesn't involve Purell and sanitizers. It involves what are your habits for good quality sleep, and one of them we know is that you don't do things that are stimulating and consistent with being awake. So, for example, you don't watch scary movies or, in this time, news, and then expect to turn your brain off to relax. All your brain is going to do is what it does really well, which is continue to work on whatever you last put in. And so if you watch scary movies, you're going to invite yourself to have scary thoughts. And that could be asleep, or it could be in the form of nightmares. I mean, either one is possible. Unless you're so sleep deprived you just collapse. Don't drink a lot of caffeine. Don't have a Red Bull and then try to go to sleep half an hour later. Don't put a lot of nicotine in your system. Don't have cocaine and try to go to sleep. I mean, there are a lot of reasons not to have cocaine, but all I'm saying is notice what you're doing and then notice what happens after. And if you're having trouble sleeping, one of the things that doesn't work is to do stimulating things. And these are all different kinds of activities that are stimulating. Now, at the same time, if you don't move and run around and you have kids, we've had children, I had siblings, if you didn't move around during the day, then know that you had too much energy to sleep at night. So yes, you have to burn off calories, you have to have engaged, you have to have thought about things. So your brain needs to be challenged, your emotions need to be challenged, your physical body needs to be challenged. Then you can rest. And rest is an important part of restoring the energy of all those body parts. The other thing is, if you find yourself with repetitive worries, sometimes that's where medication is helpful. Sometimes that's also where developing a habit, and there are a couple that are quite useful. One of them is things that come to you right before you go to sleep about, oh my gosh, that's what I need to do tomorrow. That's what a pad and paper by your bedside is for, or in your bathroom sink, to write down those things, put it down.
I did that
and
last night.
tomorrow morning,
Did it
you
work?
can-
Oh yeah,
Yeah.
yeah. I'm a big believer in
So-
journaling and writing down
Exactly.
as you.
exactly.
That's the way my brain works, but you got to get it out of your head.
That's exactly right, yeah. And then some other things I just wanted to add is just even the routine, your regular sleep routine, turning off your computer and your technology as well, reading a little bit before you go to bed, turning down the lights, lavender, people, is it a good relaxant, natural, that can help you kind of
So
drift
you
off
can
to
either have a
sleep.
spray or a sachet.
Yep, and those things are just simple things to make sure that your environment is a nice calming environment as well.
And they have recommended for decades that you don't do the things you do when you're awake in
bed.
either the room or the bed that you're
Mm.
trying to sleep in.
Mm-hmm.
So at a very minimum, if you're in a studio and there is only one thing called the mattress that is your surface to use, like what you were talking about before about wearing different clothes for the daytime activity and the nighttime activity, making the bed can be as simple, because it's both the visual and the psychological and the sensory input, that the cover on the bed being over it versus being under it is a different cue to your body. So making your bed is an important part of the bed now being daytime furniture
Right.
versus nighttime furniture.
That's right.
And it's very interesting. Our brains are so sensitive that all of these cues are important.
We have a question coming in here on Facebook, and for those following along on Facebook Live via Cat TV, if you have questions for Dr. Reeve or Lorna, please be putting them in the comment line and we will get to them as we can. One question really goes, I think, to the heart of most of our concerns here. How can we help individuals that may be suffering from some depression, from this physical distancing? What may be some warning signs that should concern us, or tools that we can help to share with them?
That's good, and I think that that's probably a fairly common concern for many people who are out and alone and distant from their supports. Do you want to?
Well, I think there are a couple of things that jump to mind right away, and that is if someone is changing their pattern of response. So by that I mean, if I'm in touch with you normally once a month, you wouldn't be wondering about me not calling you once a week.
Mm-hmm.
If my pattern is once a month, then that's the, unless you call me and say, listen, I really want to hear from you every week, and then I don't call, it changes the expectation. So before you jump to assuming somebody is being quiet or withdrawn, you find out what are they actually thinking, or what is their intent. Like maybe they're turning off their phone at a time they used to talk to you, because they are actually going and settling themselves down at night and trying not, so verifying that in fact they are withdrawing. Is the person suicidal is always a big question. We are in the midst of trying to increase everybody's awareness about the risk of suicide in the state of Vermont over the past year a lot, and so this just amplifies that is a concern. And that's where being in connection is really important. So you call for mental health assistance and backup if you're seriously worried about somebody in trouble. And that's, again, why we have 24/7 emergency services. There is a suicide hotline, prevention hotline. I know, I watch my words a little too carefully sometimes. And then what else can we do is suggest activities or ask the person, would they be willing to join with us virtually in trying something? So two things that I've read about is that volunteers are needed at places like Meals on Wheels in Bennington, where their volunteers have decreased. I've read about in New York City where college students have become invisible hands, is what they call it. So for people who are having a hard time getting out, and particularly elders, they're going to the store, leaving the groceries at the doorstop, being 6-12 feet away, but having a brief interaction so that the person who's living alone actually sees a live face, because they're not very used to social media, and being reassured that the world is out there. And those people feeling like, wow, okay, there is a community, they do care, and they are responding. My mother's home aide was telling me just this morning how she brought a protein shake to another client who needed it and forgot to put it on her grocery list. And just the sense of being cared for, that something in her diet was remembered. And so sometimes when people get forgetful, it's actually showing that you care is the first step for re-engaging them. Did I answer all of the components?
I think so. Lorna, anything to add around really severe depression, verge of mental illness? What are some warning signs? But also, what can I do? And I think we mentioned the prevention hotline before. So,
well, I certainly think that if there's a concern of an individual in your life or in your home about severe depression, or certainly any suicidal thinking, to reach out to UCS and emergency services and talk it through with them. What are you seeing? What are you concerned about? Being able to figure out a plan, being able to get that person connected to somebody that they can talk to. Sometimes it's very difficult to somebody who has some significant depression to do things. You know, we often kind of say, well, just rally and come on, you could do this, and that's not what it's about. So that is a very hard place to be. But certainly now that it's telephonic and on the telephone and on video conferencing, it may actually be easier for somebody who is experiencing some significant depression to connect with somebody that way. It makes the connection, but it also makes it a little less scary than going into a mental health office, because you're in the safety and security of your own home while you're making that connection. Other things that you're thinking?
Yeah, I mean, when you get to the level of, is this something that needs treatment? Is this something that needs medication? Lots of people have fears about the stigma of mental illness, the desire not to, and have a mental illness, and the fear that somehow there's something wrong with them, that they're deficient. And this is not their fault. This is something about their way, their emotions, and their experience of the environment are responding in their own brains and in their own level of stress that is causing them to be unable to access the parts and the neurotransmitters that allow them to be interested and to concentrate. And so they are as much a victim of what is happening in their body as people around them are guessing at what they're communicating, what their intent is. The kindest and most important thing one could do is to let people know that they're not being abandoned, that they are seen as a person and not as a walking disease. That is an ongoing struggle for people with mental illness. When you have a chronic mental illness, such as recurrent depression or bipolar illness, you worry about every possible stressful situation tipping you over into another episode. And you sometimes develop almost mythical patterns, like if I just do this and don't do that and don't do that, then it won't come back. And, you know, maybe it will, maybe it won't, but not getting stuck in being afraid of that is just like not getting stuck in being afraid of dealing with COVID-19. The trick is not getting stuck. That's the real trick. We have to get through bad times. We have to get through episodes of worsening psychosis, hearing voices, seeing things, episode of hopeless feelings, episodes of feeling helpless, episodes of feeling abandoned by everybody, to realize, to allow that possibly we are not. How do you build trust? You risk, you experience a little bit of connection, you build on that. So in other words, you have a hypothesis that maybe you can trust somebody, you give the opportunity, not too much so you won't get hurt too much, you try it, and then you decide if you're going to try it again.
Mm-hmm.
And that's the same piece that you do. You build on experience.
Mm-hmm. And I feel like I wanted to also mention substance use. That
Yes.
certainly at this time there's a higher rate of substance use. There's coping mechanisms that people use. Some of it is
Dance parties.
dance parties,
Are
80s
okay.
dance parties, and
Yep.
the art, those are okay. There's coping mechanisms that people use that could be overeating, it could be a variety of things, and substance use, drinking, drugs are certainly something that would be on the rise given the leveling of anxiety, since that would be a coping mechanism of sorts, not necessarily a beneficial one, but certainly one that would make people feel better under the circumstances. So there are still people providing services and supports for that, whether it's an online AA meeting, whether it's calling, again, UCS. We have substance abuse therapists that are available, and we do have even groups virtually available for folks. So if you're concerned for yourself, if you're concerned for a family member, that again is something to a time to reach out.
And you know, we work closely with Turning Point staff and peers, and they work closely with the hospital, and they're still working closely. And they're doing a lot of virtual connection too, because
Right.
they've had to close having in-person meetings where people are too close
That's right.
to reduce. But the need for recognizing supports is not gone.
That's
And
right.
there's a way to do that. And so it's always asking, how can we do it? Not, oh, we can't. It's
Mhm.
how can we?
That's right.
And that's, I think, what you were coming back to, is the innovative. How could we do it differently?
Sure.
Yeah.
Perhaps a final question, unless we see anything else come up on Facebook, but I'd like to wrap up. You know, we've talked one end of the spectrum in terms of emotions and actions. What are some emotions that are okay, that we should be feeling, that, I think we brushed up against it with, anxiety is to be expected here. VPR was doing a segment right before we went live around mental health, and there was a good segment on, what should I be feeling, and what actions are okay, and maybe there's even a little bit of that loss cycle in there, that we've all lost something. We've lost our normalcy, and that we need to be expecting that we're going to go through the cycle of loss here and
That's
all those
right.
phases. So can you speak to that a little bit?
Yeah.
Well, there's huge loss on the horizon.
Yeah.
It's not just loss of people from the death, it's loss of normal patterns, and there's loss of economic freedoms and habits. And whatever else you think, these are times of large change, and that's always very unsettling. And so people have all the reactions to change that you have with any major change in your life, including losing somebody close to you and death. You get anger, you get grief, you get anxiety, you get hopelessness and despair, and you get avoidance, and you get denial. No, it can't happen here. No, they're going to skip us. We're a small rural state. It's not going to affect it. It hasn't gone over the border because we have a border. Well, a border is actually an imaginary geographic line, right? So all of those are normal responses. Again, the real, in a nutshell, bypassing all the big language, if you get stuck in one feeling, that's the problem. Going through a lot of feelings and continually moving through them is a normal pattern.
Yeah.
Good,
And
helpful.
I think I would add too that kindness now is, I think, more important than ever. Everybody's under stress. Tempers are maybe a little shorter than usual. Frustrations are higher than normal, and that being able to have some level of understanding that, you know, realizing what you're feeling, everybody else is really mirroring those feelings as well, and being able to give yourself a break for once, too. For one, is understanding that you're going to get angry and you're going to be frustrated and you're going to be surprised maybe at some of those things, but to be gentle with yourself, and then as well being gentle with others and being kind to others. And through this, we've heard so many great things that the community is doing for each other and helping each other. It's really an amazing place to be, and I know that that will continue regardless of what's to come.
That's true. In fact, there's a little poster on our health information management office door that just makes me smile every time I come in to talk about a medical record. It says, "Throw kindness around like confetti."
There you go.
And I think that image of, it's not just one thing, it's all over.
Right.
And just sprinkle it.
Right. Because the other thing is that you can still feel joy, you can still feel happiness, you can still feel all of those wonderful feelings that you get too as a human being through this crisis too. So try also, if you're having a good time and you're laughing and you're enjoying whatever it is that you're doing, to not feel guilty about that too, because we're going to have positive feelings throughout this no matter what's happening.
So 2 days ago we had that snowstorm. Did you notice that the quality of the snow is really good for a snowball?
There's that silver lining we're
That's
talking
right,
about.
exactly. There always is.
What
It's
a-
better than a month ago.
What
That's
a
right.
what a great way to end on throwing kindness around like confetti. Lorna and Dr. Reeve, I want to thank you so much for joining us today for our telecast, and for you, the audience. Hopefully you learned something, and hopefully you've shared something with some friends of yours. But if nothing else, we hope everybody throws kindness around like confetti, and we thank you so much for tuning in. I'm Matt Harrington with the Southwestern Vermont Chamber of Commerce.
This is wonderful, man. Thank you.
Thank
you.
Yes.